Hey everybody, up next we have Dr. Alex Cahana, who's going to be talking about the future of decentralized health. Alex, it's a pleasure to have you here.
Well, thank you. Thanks for having me, and it's always a pleasure to be at the GHIN, the Global Health Impact Network conferences. This is wonderful. Thank you. My name is Dr. Alex Cahana, and I'll be talking to you about decentralized health. And hopefully by the end of the conversation, we will understand how we can change healthcare by changing our behaviors using behavioral economics. I wear many hats, as you can tell, but for this conversation, really think of me as someone who is interested in decentralized economies and on a mission to blockchainize healthcare and healthify the crypto space. So my background is I'm an anesthesiologist and I've been in pain medicine for way too long. I've been involved in the integration of technology and digital health before it was even called digital health for almost 2 decades now. I've been really intrigued and interested in decentralization and distributed technologies, mostly distributed ledger technology and cryptocurrencies, I would say since 2014. And for that work, you see here that I co-edited the HIMSS textbook on blockchain in healthcare. I have been working closely with the United Nations Commission on Distributed Ledger Technology Advisory and the European and African unions in regard to data sovereignty, data privacy, and data liquidity. To start the conversation, I think the most important is to what is digital health, and we've been living in this world of digital health for well into at least 15 years, if not 2 decades. But the data arrangement of it is centralized. We're used to thinking of large clouds and large data pools, and that's where all the information is hosted. For many of us, the interaction or interface with digital health has been a mixed blessing of, on one hand, introducing some efficiencies within the system, but also some feel that it has been onerous and perhaps distracts from the quality of, I would say, our clinical interaction with our patients. The official, I would say, definition of digital health is really this convergent of what we've seen in genomics and in computer sciences with health, but also with healthcare living in society. So the idea basically is to translate data that is accrued, be it in a clinical trial context or in real world data, and allow to develop actionable information where people can get better insights into their health and into their family's health and live better and more productive lives. And the idea behind it is that with that, healthcare will be not only better, but also cheaper and have a better satisfying experience for patients and also for the providers themselves, knowing the challenges and burnout that a lot of the healthcare community is experiencing. And we can see here these 170 exabytes of data that is enveloping our world, anywhere from the wireless sensors and devices that we're seeing, the mobile connectivity and the social networking, the whole universe, and some calls it the metaverse of creating avatars and creating our own digital twins, is really with the idea that instead of just tertiary prevention where we're treating diseases, is to actually engage into primary prevention and even in prediction and keep us as healthy and maximize our longevity as our genetics allow us. There are multiple technologies that are out there, and first thing you'll notice is that blockchain is not one of them, because I will try to argue and convince you that blockchain is less of a technology and more of a school of thought, or more of a uh, governance mechanism of all these data that are generated by these core technologies. But the core technologies that we are aware of as physicians in our daily life is, of course, the remote care monitoring and telemedicine that has developed exponentially since the COVID pandemic started. There's now a little bit of reversal in terms of our willingness to continue and pay for it, but I think that nobody will argue the utility of the technology and the things that we can do now, thanks to our ability to see, monitor, and follow on patients from afar. The Internet of Things is more of a invisible or back end technology that we take for granted. We don't realize the robustness of the machines that we use. Many of us think of the iPhone from our generation as a communication similar to the telephone, and very few actually think about it as a computer that is in the tip of our fingers. And really, the Internet of Things is that idea of bringing in these machines, be it in the hospital medical devices or at home in the smart home, computing power at the edge, that changes the whole data structure, anywhere from clouds to cloudlets, and their ability to communicate between themselves. And so some call it the Internet of Medical Things or the Internet of Health Things. And most, of course, familiar with us are our Fitbits and our Oura Rings and the whole wellness landscape that has embraced our ability to biohack the way we live. And artificial intelligence, which is a host of multiple things, is kind of like the overall title for different types of learning abilities that machines have that make them seem that they're intelligent. The whole discussion of either machine learning or deep learning or reinforcement learning or deep reinforcement learning can be a whole conversation on its own. But the idea, again, behind it is to create this seamless connection between data, information, actionable insights, knowledge, and eventually wisdom. And whether that wisdom will ever reach to human levels or better it by its ability to recognize things that perhaps we can't, or whether it can emerge with its own consciousness, is a separate discussion. But it is clear that AI is a main contributor and disruptive driving force in healthcare. And it's not surprising that already there are reports from the first half of this year where private investment in digital health has surged. And in the first 6 months of 2021, it has already overpassed all 2020. And so there is a huge interest from the investment community to continue and develop these type of core technologies. And I specifically work in emerging markets because I believe that there is a real opportunity here to leapfrog these systems that in many places are paper-based and analog, and move into these new digital architectures that I believe should be decentralized and use, for example, blockchain technology, and not almost like obviate all the side effects and all the problems that we see in the current digital health system, not only in terms of cost, but also in terms of the user experience and the user interface, the friction that is involved, the capital leakage and cost that it creates, and really move into a system that is not only more friendly, but also can provide immediate more gains, both to patients and providers during their therapeutic dialogue. Now, if there's one thing that COVID has shown us, and it's shown many vulnerabilities, is that we need trust. And when I say trust, it's not only the veracity of the CDC guidelines or the consistency of whatever federal or state policies command, but also in terms of trust of the numbers of how many have been infected by COVID, how many have passed from what, anywhere to how many ventilators are they, how many hand sanitizers do we need? Is there really a shortage of toilet paper, or is a vaccination boost necessary? So the whole idea of creating pristine, reliable data that we know its provenance can be solved by blockchain. And the way I like to explain blockchain is that simply it's the software solution to the social problem of mistrust. That I want to believe what I see, I want to believe what I hear, I want to believe the contracts that I sign, but I can't. It turns out that it's not true. I don't know. There's some opacity in it. There's some inconsistency in it. And the decentralization of that data can contribute to the integrity of that information. Now, how does it do? How does it do that? And if anybody will Google how does blockchain work, they'll find out these type of things that I'm not always sure that they're very helpful or that we can actually understand what it means. The way I like to explain it to myself is, for example, for this presentation, I worked on Google Slides. And so I just put in whatever I want. I put in all the data and information that I thought was salient, with research, with some speculation, and just showed it to myself. But then I started to share it with other people. I made it distributed. So other folks started to look at it and they had remarks and they weren't sure that the data is accurate or that the statements are not misleading. And so I started to pay attention to the quality of that information because of the fact that it was not just centralized in my eyes, but it was organized in a way that other people were looking at it. And this is something that we call a private or permissioned blockchain. I gave permission to people to look at it before I sent it out. Now imagine that I would put it on a world computer where everybody in the world can look at it. Obviously, there would be a lot of eyes, and definitely there would be ideas to even improve this presentation way more than what you're hearing right now. And that is called a public blockchain or permissionless. So the idea is to create information that is not only centralized in the eyes of one or a few, but actually in the eyes of many. Where the real magic comes in is that once I sent it out, once I gave it to the organizers of this conference, I basically signed on it. I cryptographically locked it, and I said, okay, this is what I want to sign. And you can say, this is Alex at this day, at this time. It is time-stamped, audited, and we can look at the history of who changed what when. And this presentation became a block. And that is a block of data. Now imagine that block of data is done. I'm doing this every day, or every day I added a new slide, or every day I added a new presentation to my library. That is a chain. So it is a block chain where all this information is unchangeable, or what we call immutable. It is transparent. It is audited. It is traceable. And obviously the data in it is way more pristine than if I would have just written it all by my own and decide what information I do or do not want to include. So basically, blockchain is a peer-to-peer network technology that, from a physician's perspective, minimizes the need for trust agents. So the reason that we have not used decentralization is because we had all these trust agents around. We asked for notaries to verify our documents. We asked nurses to put witnesses on our medication disposal. We ask the front desk to pre-authorize or to verify certain transactions. So we've created a whole economy of administrators and billers and coders and brokers, and not just in medicine. This is in all wakes of life. We have created this economy of third parties that they are our trust agents which we trust will represent us and represent the veracity of the data that's inputted. And unfortunately, this has not been the case. And in many times, we know that this data can be manipulated. And so this trust that we're talking about that is in blockchain is actually embedded in its architecture and in its structure. And the way I like to think about it, the advantages of it is, for example, with long distance phone calls. I'm old enough to remember that when I called Australia, it used to cost $10 a minute, and now it costs zero. Why? Because there's VoIP, voice over internet protocol. And so blockchain could be DOIP, data over internet protocol, and cryptocurrencies can be programmable money or money over internet protocol. And the reason this exists is because basically the internet itself has not, during its creation, inserted an identity protocol. And so I'm sure you're all familiar with the caption of the dog that's sitting in front of the computer saying, "Nobody knows I'm a dog." So here, this peer-to-peer network technology really verifies who is on both sides of that network. And so, as I mentioned, there are different flavors of blockchain. There's not one kind of blockchain or one kind of internet, if you wish. There are blockchains that are more public, they're permissionless. It's an open network where all devices can communicate, and the ledger, the list of informations, the list of slides or the list of numbers or calculations are open source and people can look at it. And then there are private blockchains that are permissioned, that they have to be permitted, and we're very much familiar in the healthcare system of the permissioned design, where only certain people, if you're an administrator or a healthcare professional at different levels, what they can or cannot look at. And then, of course, there are hybrid designs where parts of it can be public and parts of it can be private. Certain types of information you only want that people can have access to it, and you can revoke that access when you want, and others that can watch at all time and have access, like my information on the DMV, or someone who wants to look up my number in the phone book. So this is called a hybrid or federated blockchain. Now, why is decentralization so exciting? Now, if you look here on the left, when you see things that are centralized, you can see that that's a honeypot. So imagine that white dot as a source of information or a lot of money. And these are around them are all these people that are trying to steal this money. And so you have all these people that are trying to hack. And this is really what we're going through. All these data centers and what we're seeing in medicine with ransomware is a net result of the centralized structure of healthcare networks. And so they are attack vulnerable. And so when you decentralize it, you don't have one point of failure, but you have multiple points where the amount of information is actually protected, because no one person can get all white points at once. But once you also distributed it, then those attackers actually become interdependent and become defenders. It's thinking about almost like the prisoner's dilemma, where you agree to collaborate or have a competitive collaboration because you have more to gain by working together and more to lose by working on your own. So it's really a community-based technology where you create economic incentives and also, I would say, computational incentives that protect the system from being hacked. And simply because if it is, then everybody gets hurt from that malevolent behavior or malicious actions. Now, one thing that determines the type of blockchain that any organization will use is part of what we call the blockchain trilemma. And so it means that you can have two, but you can't have all three. So if you want something that is really speedy and fast and super secure, it cannot really be decentralized. And so that's what we see, for example, in money transactions through our credit cards or PayPal or Venmo, where they are secure. I don't know about super secure, but they are secure enough, and they have quick transactions, so you don't have to wait for minutes for the transaction to go through. But again, you are totally dependent on the goodness of their heart. So if there is a hack to one of the companies or providers, or if there is a malfunction at one point, then suddenly everything can be lost, or everything simply will be frozen. Now, there are types of blockchains that are super secure and very decentralized. And one of them, the most famous one, is probably Bitcoin. And Bitcoin has not been hacked. It has been used as a currency for hacking. That's something different, but it has not been hacked. And so the reason is that because it is so decentralized and because there are so many people involved, it is protected in a way that the trust, the computational trust, makes its attack almost impossible. But then others, if you say, well, I can't wait for a transaction for 10 minutes, I want to wait only for 2 minutes, then you will have other flavors on it and other solutions of it that will have keep that decentralization and will be faster, but of course will be to some extent less secure. And when I say less secure, then each one has a level of tolerance. Do I really tolerate that? I want 0% never, ever, ever being hacked, or am I willing to have a risk of 1 in a billion, 1 in a million, 1 in 100,000? So this is why we have different flavors of blockchains. And I would like, again, use the analogy that if blockchain is the internet, then all these type of cryptocurrencies that we hear about and we see, Polkadot and Cardano and Lightning and Stellar and so on, these are like different websites that are out there. So what does that have to do with healthcare, or what type of emerging use cases can we have if we agree that, again, like, as I said, blockchain is the software solution to the problem of trust? So since healthcare is a high trust environment, there are certain areas where blockchain can be extremely helpful. For example, digital identity management, supply chain management, the clinical research, and finances and insurance records. And this is really all the things that we've seen in COVID that really have not worked. The digital identity management of knowing who was vaccinated, who was not, transfer of information from one state to another, the records of the people who were infected or not, have been various levels of qualities that are influenced in state levels. And we know that there were states that manipulated their data for political expediency. The healthcare, the health supply chain management in the early days, especially when it pertained to PPEs, private protection equipment, and ventilators. There was a lack of interoperability and liquidity of that data that can be solved by the use of blockchain. And needless to say that clinical research is highly centralized, has a lot of friction, costs a lot of money, and many organizations opt out from doing real-time research simply because of it being cost prohibitive or functionally impossible to execute. And needless to say that there's a whole economics behind it, which I'm very passionate about, and I will speak to it a little bit later, where we can also include the users, meaning patients and healthcare professionals, in the economic activity that healthcare generates. So when we talk about identity management, what we talk about is person-owned, citizen-owned, patient-owned digital identity. So this is how we can track people in a way that keeps them private and keeps them in control. So obviously the identity issuer is something centralized. It could be the state, the government, the university, that could sit in an encrypted attestation in a cloud or in a decentralized cloud or on the phone of the user. And the access to it can be governed on the blockchain, that register identity. And so data doesn't have to reside on chain. It's actually preferable that it doesn't, but the access to it is done on chain, and the data, raw data itself, is off chain. And whoever asks for that data, the user can give through giving access or revoking access, cryptographic permission to people to look at it. So you can understand this is very helpful for credentialing, or this is very helpful for locums. And so you can imagine a system where really we don't have to spend so much time, energy, and money in order to acquire these different types of identity that are asked multiple times for multiple reasons. If we want to track material, for example, then the supply chain, again, we are looking at multiple stakeholders that write into a ledger, and they can be monitored and given different accesses to view that data under privacy regulation. And so anywhere where the vaccine, for example, can have a temperature monitored label put on a blockchain register, and then the manufacturer can distribute it to the warehouse, and you can see under what conditions and when and who transferred the first batch, and then the second batch and the third batch, and it could be geolocated or geotagged. This can enhance the ability to schedule or to understand the inventory management of, for example, a vaccine. And when it gets to the healthcare provider can provide this information of either adverse event monitoring or any type of inventory management that is I would say proactive and agile, and go into reporting dashboards that then again the user or the provider can give access to different types of agencies. So in that way, we can digitally enforce these protocols and automate the reporting, and there's no need for all these intermediaries that can fail at each and every point. And when you track people and you track material, you really get pristine data. And here you can see where each person now has their own QR, they register, they can provide their pre-health assessment and do their screening tests. The healthcare professional can use a quote unquote blockchainized or validated vaccine where its provenance is known. The data then is married. And after that, it can be part of the whole digital health assessment and analyzed either for reporting or for predictive AI or machine learning analysis. So you can see that these technologies already exist. Now, the question where they are used or where they're not used or why they are not used is a separate conversation that I'll be glad to answer any questions about. But I just want you to leave with the strong impression that these things already exist. Another use case, for example, is clinical trial management. And again, we all know how expensive it is and how frictionful it is and how data and payments do not arrive in real time to the various stakeholders. And again, the idea is all the same, that the subject of the trial is the center through his or her digital identity. He gives or she gives access to either the healthcare professionals that participate in the clinical trial or the virtual primary investigator or other research professionals that are interested in that information. It is connected to other remote devices that can curate this type of data, and all stored on the device, or at least off-chain in a cloud that has access on-chain through the device, and that there can be a direct data transfer to the sponsored database. So again, we change it from a patient-centric to really a patient-driven process where the patient is motivated and advised to share information with the various stakeholders. And of course, for me, the most interesting and the most relevant for everyday life is really a patient-owned, self-sovereign, or patient-owned personal or electronic health record that is decentralized. And so it's based, again, on the self-sovereign identity that is anonymized. You can permiss or revoke access to these data. And so you can see here on the right-hand side, where on this access control, I can say, okay, for my daily diary, my physician can look at it, but he can only view it. He can't alter it. They can't alter their notes, or they can alter and edit. The prescriptions they can view and update and edit, and medications the same, and so on. So you can decide who sees what when. It can be time-stamped, and I can say, I will give it to to Dr. X tomorrow between the hours of 8 to noon. And so on. So these are traceable timestamp data, but most importantly, they are portable and interoperable. And that's very important because electronic health records here in a centralized structure have been built for brick and mortar. So if building A has one electronic health record and building B has another, and they don't talk between themselves, then it's impossible to transfer the information, and so the data becomes siloed and illiquid. Whereas if it is held by the patient is portable, and it can move from A to B and interface with the respective electronic healthcare system in building or hospital A and B. And I think the most exciting of all is that because it is on blockchain, it can be tied to programmable value, or it could be money, it could be services, it could be access to different types of features that can reward or discourage people to behave in a simple way. And we can almost take it one step further, and this is the work that we're doing currently now in Africa, where we incentivize patients to social distance, to wear masks, to participate in surveys, to eat well, to sleep well, to consume less unhealthy food. All these are part and parcel of the ability of the physician to impact the patient by inclusive economics. So a decentralized health ecosystem, again, in general, is based by a patient who has a self-sovereign identity that is theirs. It is immutable, cannot be changed, it cannot be tampered, it cannot be altered. It is audited and time-proof, and they can access it to any of the stakeholders, be it a doctor or a hospital or payers or research institutes or the industry. And of course, if we connect that again to currencies, and again, this could be real money, or this can be features that have value. I want to incentivize doctors to treat patients in a certain way, and I give them access to libraries or going to conferences at half the price, or I incentivize patients to eat vegetables and not smoke. I provide them access to insurances and copays and less cost following certain types of behaviors. This is all possible in a decentralized health and wealth ecosystem. And the last, I would say, use in the future, and this is why I'm so excited to work with the Global Health Impact Network, is that these abilities to provide verifiable credentials to the members of a professional community, then you can not only reward them for participating in that network and give them more of a voice, either by their reputation or by voting, but also to provide them opportunities to invest and get rewards in the cryptocurrency market. So to summarize, I would say that decentralized health is better when data is decentralized. It creates trust. And again, when I say trust, I mean computational trust, not just because Alex is Alex. I actually believe this because mathematically it is encrypted and unhackable. It is attack resistant, sensor resistant, and collusion resistant. So the temptation to fudge the numbers or change the numbers or fix them to our will is not possible. But most importantly, it really creates a community of users that are connected by a consensus that is built on what is valuable for that community. So a community of patients would be maybe different than a community of doctors or a community of nurses or a community of a consortia in the industry of pharma or medical devices. And it connects data in a way that we become interdependent and where our interest is to maintain the integrity of that data, because if everybody starts lying, then we really don't know what's going on. And this is really what we're living through, the fake news era. And finally, unfortunately, the macroeconomics of healthcare system excludes patients. It does not motivate them or tangibly reward them to behave in a way that is healthy. And if I would use, I would say, blockchain parlance, we use in the healthcare in the U.S. Death coins, because you get more coins if you're sicker and you need more tests and you need more procedures, and we don't reward them with life coins if they maintain health and exercise and sleep well and engage in mindfulness and in purpose in their everyday life. So I think that the future of where healthcare should look at is the burgeoning ecosystem of decentralized finance and DeFi. And the reason is because if you look at it, it is a sensitive, high trust, private data environment. It has multiple stakeholders, just like in healthcare, where there are payments and infrastructures and exchanges and custodians. You want to know your client, know your transaction, know the identity of who's using it. And you have different insurance and insurance products. And of course, the increased area of creating lending and credit for users of healthcare, and prediction markets and marketplaces for data. So at the end, I think the most important thing that is to think not about blockchain as a technology, because technology doesn't do anything. It's what people do with that technology. I would say that this type of decentralized school of thought will allow us to transition and transform from health service consumers to actual health and wealth producers. And this is really what we're aspiring to. So I'm really, thank you for listening, and I'm now open for questions and looking forward to answering it. Thank you very much.
Okay, great. Here we are. Alex, great to see you.
Good to see you. Thank you for the opportunity.
Of course. It's always, I'll take a brief opportunity to just to rave about Alex. Alex and I met a while back, and we've been working together now for a couple of years. Alex is just an incredible resource from many different perspectives, but certainly as a global expert in blockchain. He's also involved in some incredible initiatives across the globe, including in Africa, which Global Health Impact Network is hoping to get involved with and work with him with respect to that. And Alex is truly, as we say in Yiddish, a mensch. So I always use a little bit of Yiddishisms when I speak. So let's go through some questions here. We've got a couple. You know, I'm sitting in front of 3 different streams here. I've got a YouTube stream, I've got a Zoom stream, and then I've got a list of other questions that were provided as well. So let's go through that. So let's start with the YouTube stream. And actually, Nicholas has a question. He says, is there a blockchain project that could handle COVID vaccine passports, Alex?
Well, the short answer is, of course, yes. And there are actually multiple ones. I think that the longer answer is what is the intention behind it? And for this, I would urge people to read a bit about the history of passports in general. I wrote a post on this on Medium a while back. The question is, what is the intention behind these passports? Because originally, passports is to allow people to pass ports and to move from one place to another with an identity. And what has turned, especially in the, I would say, late 20th century, it has actually become an obstacle. Everybody who knows about visas and how to move from place to place, it has disenfranchised actually vulnerable populations. It's become a tool of centralized governments to actually control the movement of people. So from an approach of laissez-passer, where you let people pass, it is actually now a whole list of reasons why not to pass. And in that, now we have COVID. Now we have COVID as another reason. And so they say, okay, we need this and we need that. And so the true question is, are the passports integrated in a real global response to try to eradicate COVID-19? Is there a strategy? And if there's a strategy, I would love to hear what that strategy is. Forget the United States and the difference of what happens in every state. But in general in the world, is there a concerted effort to try to eradicate COVID-2 from our unit? Or is this, we're just going to have it with us like influenza with the cost of taking care of that every year? So the technology answer is very simple. Yes, there are applications out there. Some of them are a little bit better than others that have a self-sovereign, decentralized identity structure. Some of them have really nice front ends, nice interfaces. I just did one in New York because this morning I read that I can't go into restaurants without having a passport. And so I downloaded the New York State one. I put in information. I don't know who can see it. I don't know how it's protected. I don't know what the cryptography behind is it. But I said, you know what? For giving that information, at least I can go and eat, some delicious food. So this is really not a technology question. This is a question of what are our governments selling us on this story. And I think, and this is very important for the audience to realize, we are sold a story that is simply not true, where we have to give up all our information to stay secure. In order for you to stay safe, you got to give me all your information. You need to give me your secret bank account, your number. You need to give me everything. And like that, I can keep you safe. And that is a false narrative. There are decentralized technologies, not only in blockchain, there's federated learning, there's ways to transfer information for machine learning analysis without divulging IP or without divulging sensitive information. And so this is why, for example, the geo-tracking that at the time Google and Apple offered did not succeed, because we're here strong enough and private enough to say, wait a second, I don't want people to track me using Bluetooth with the false positive stuff. And so that's the idea behind it.
Great. Thanks, Alex. Great answer. Great, interesting question. It's an example of, you and I have been around on this planet a long time, and we've gotten to the point now where the technology has got beyond the needs of society, and we clearly haven't defined how it can be used appropriately. So the technology is there now, but now the world has to catch up a bit. So there's an interesting question here by Will Chen, and it says, can you comment on the energy input, quote unquote, sustainability concern of blockchain technology? Or does this concern only apply to virtual coin mining?
I think it's an important question, because we read it all the time, and this is why it's so important for media to actually come up with thoughtful pieces. I would recommend everybody to read Nick Carter, NIC Carter, CARTER stuff. The narrative that is behind the idea that Bitcoin mining is consuming more than Denmark, Greenland, Switzerland, choose the flavor of the week, is simply out of context. The use of energy to maintain the safety of the system, the safety of the network, is built in places where there is an overabundance of energy. In other words, not using it, that energy would go to waste. So this is not, I am taking away from cities or from rural areas that need that energy in order to mine cryptocurrencies. This is like, for example, anybody who knows aluminum, these are very intense technologies to create aluminum. And then with that aluminum, we go and we sell it and we use different things with it. So that is the same thing with cryptocurrencies. We move them and afterwards they serve different things. What is wasteful for electricity is, for example, to light trees in Christmas or in Hanukkah. That's waste. So the question is, are we willing to waste? And of course, if you don't see the intentionality or you don't see the need to put in energy to maintain a network that, by the way, uses way less energy than banks and fiat currencies and all that energy ecosystem, then it's easy to say, oh yeah, it's very wasteful. But in practice, yes, there needs to be movement to renewables more, but it is not using energy that is for core needs, but rather surplus energy that otherwise would go to waste.
Great. Thanks, Alex. We've got another question by Matt Weeks, and he says, Blue Cross is working on a Blue Cross component to pre-approval and payment agreements between payers and providers. The idea of the immutable ledger and single source of truth are among value points. What are your thoughts on that?
I think it's great. I think that it's great that serious companies are starting to realize that there's a technology out there that can be used, that can improve their processes. But again, like with my answer with the passports, the question is the intention. So just like with the passports, is the intention is to allow you to pass a port or to give you a reason why you cannot leave your house? The question here with the payers is this to increase their margins by automating their services and making everything streamlined, but not availing it to a front-end user experience and not utilizing this powerful tool of self-sovereignty and the ability to tokenize and reward users? Mm-hmm. That's really the issue. So again, these are all great questions, but I want to always take a step back and ask what is really the question behind it. Because like I said in my talk, technology does nothing. It's what people do with technology. So we can use blockchain as a hammer and break systems and make them more efficient, more automated, and displace more people. Or we can do a Michelangelo David and build masterpieces where we include users like patients, like doctors, like healthcare professionals in the economic activity. That is when the secret sauce of blockchain is leveraged.
Gotcha. And just a little clarification in the background here. I misread what Matt said. He put BC, but I interpreted that as Blue Cross, but he's talking about his organization and he meant blockchain. And his follow-up was to create a streamlined processing and reduce denials and the expense of working through them. So that's kind of what they're working on.
So I would say to Matt, go for it, improve it, but use it for the betterment of your community.
Great. So now here's a question from Patrick Damaso. Will moving health data to a distributed ledger really solve the interoperability / data siloing problem? Or is data capture and retrieval just not properly standardized?
Yeah, I think you're right. I don't think that it will solve the problem of interoperability. A lot of times it is thought that it can. I actually, in the beginning, I don't know, 7 years ago, thought that that is it. But when you go deeper and deeper into the technology, you actually realize that that is not the case. Data interoperability will happen, like with the prisoner's dilemma, when it makes sense for me to share information with you. As long as I don't want, there's no incentive for me to do it, or I believe that I will lose by telling you something that I think is secret, there will not be interoperability. So yes, there's taxonomy, standardization. We have this fetish towards it that I think will diminish with time, because now we understand with AI and machine learning that non-structured data can actually, everything can be analyzed. And just like I was reading earlier today that everybody should not be coders but no coders, because soon the machines will be able to code. And now they're actually, anybody who read GPT-3 knows you just say something and then it already codes it. So the point is that interoperability, again, is not a technical issue, although there are a lot of technologists that would like us to think that. It is more a macroeconomic issue. And so what we need to build is a new way of a business model, which is called coopetition. It's collaborative competition. We compete, that's fine. There's GHIN, and there can be GHIM and GHIL and GHIF, and all these GHI whatever. But it's better for us because none of us is as good as all of us. And so you have to build in incentives, monetary and non-monetary, so that this liquidity that will happen is meaningful from a I would say transactional perspective.
Great. Here's an interesting question from David Liu. Will quantum computing destroy blockchains?
So it's interesting because we barely started one technology and already our minds are going fast into a technology that might be ripe in 3 decades, of saying, well, that makes it so it's equivalent of the horse carriages, saying, should we really go into 4 Ts, because eventually Bezos and Musk and Branson are going to take us to space, so why waste all this car in the middle, the internal combustion engine? So I would answer this with 2 parts. One part is no, I don't think, because in the meantime, as quantum computing evolves, there will be also quantum computing resistant technologies that will be created. But more importantly, and that's the second part, is not to think of it again as one against the other, but to think of it synergistically. And we see that already now with quantum key cryptography. So in other words, we can use things from the quantum world that actually makes blockchain even safer. So even with now, and just to give I'm not going to explain now what quantum computing is, but the idea behind it is that instead of deterministic algorithms, we're talking about probabilistic algorithms that all superimpose at a certain moment, that makes an infinite probability of someone coming in and identifying and going as a third party to know what's going on. So we're walking into a passwordless world. And I think that in the next 5 years, passwords will not be a thing anymore. And so the short answer is no, it will not ruin it. It will change it, and it will make blockchain stronger, because blockchain, again, is a peer-to-peer network that is anti-fragile. So the more you attack it, the stronger and better it gets.
Mm-hmm. Great. Thanks, Alex. So let's move to a topic that's near and dear to your heart and my heart, is the idea of tokenization and tokens. As you know, and from the very early stages of our friendship, we've talked about this, and I had ideas about tokenizing and gamifying the network in a way that would encourage members to actively participate and engage in what we're doing. As we all know, like the movie says, if you build it, they're not necessarily going to come. And how do we work with that? So with that in mind, I'll throw 2 ideas out. One is the tokenization of a process to encourage active participation and reward. But the other side of it is more on the monetary side. And you've heard me wax on about this. I feel strongly as the founder of the network that the network should be basically owned by its members, right? If the members are actively participating and actively innovating and actively, changing healthcare through technology, they should benefit from the other side of it. So yes, we're democratizing the investment process, but more importantly, how do we leverage blockchain technology in a way where now the members, as they actively participate and are rewarded, can then take those tokens and possibly invest in the network, invest in individual companies, invest in a fund? So it brings up the question, what types of tokens are there and what are the differences?
Well, maybe now we have a theme for our next conference about tokens, because this is like and I love this topic, and I think that people would love it too, because it's just super interesting, your questions. Just for clarity, we need to kind of make sure that we're all on the same page. A token for me is either a physical or non-physical manifestation of value. So people like to think of tokens in a casino, so it has a monetary value. Or I have my stars on Starbucks that has, I need to do stuff in order to earn them, or my miles on United that one day they call and say they're worthless anymore. So that's the problem with centralized tokens. They gamify, but they're controlled by the central parties, and so they can change the conditions. And one day a token that was worth $1,000 is now worth $1. And when we talk about tokens in the context of decentralization and blockchain, these changes cannot happen because they're embedded in the code of that token. So if I say I want to use a Gary coin, then I say, Gary, what is it that you want for the members of GHIN to be in that coin? So say, well, if you show up to my conferences, boom, you get a coin. And if you listen to Alex and this, you get another coin. If you can ask her a couple of questions, you can get another coin. And if you volunteer and call me and say, I want to do some talk, and I want to be an ambassador, and I want to, you translate the intrinsic value of your community to some tangible value. That's really what tokens are. And so you tokenize processes, you tokenize behaviors, but you also tokenize identity and status. Because honestly, as healthcare professionals, this is really what makes us move. Mostly, I know that we're all how may I make more money, but really, when you think about it throughout our careers, really what made us go through is the respect between our peers and to gain a certain, recognition. And so this is a very nice, fun way to identify it. And I know that we have only 1 minute left, so I'll finish. The different types of tokens represent these type of things. So if you want to make money on it, then these will be called security tokens, because you have to go under some security SEC regulation. If you want to do it for services, these are called utility tokens. If you want to do it for Gary, these will be called social tokens or personal tokens or work tokens.
Okay, great. And then I'm going to finish up. We've got, probably about 2 minutes, 3 minutes left. I'm going to, a question I know that's near and dear to your heart, and I find extremely interesting, is the idea of, how do we make decisions? How do we make decisions as a practice? How do we make decisions as a community? How do we make decisions as a group? We make decisions every day, and we do it in using the current system that we have. Talk a little, very briefly, about just quadratic voting and how that can change how we make decisions and decide, vote on things.
Yeah, that's a great question, and also a topic that I would love to go through next time, and because we're living now in a post-election world where we have all these confused feelings. And by the way, blockchain could solve a lot of things regarding votes themselves, but as tokens are representations of us as individuals, the voting represents the interaction between it, and we are used to thinking of one person, one vote, 1P, 1V type of voting. And the very intuitive problem of 1P, 1V is that we're not all equal. And so instead of saying, well, Gary, he did this, so he's worth 100, and I'm, just doing this, so I'm worth 10, which gives that sense of non-fairness. We create something that's called quadratic voting, which basically can capture the skin in the game. So I say, Gary, you get 100 coins. Alex, you get 100 coins. Now you have an opportunity to vote on different issues. I want to vote on the topics for the next conference. And so each one puts, I say, I want blockchain, and you say, no, I want to talk about French cuisine. So I put in a token, you put a token. Then it's the second round, because I put 2, you put 2. But then 4, 16, 6. Soon you're going to find out that all your 100 votes are going to go on just one topic. So at some point you're going to say, Alex, you know what? Have your talk about tokens, have your talk about quadratic voting. I don't care. I'm out of this game.
Right.
We can really create behavior economics that can capture not only who we are, but how we interact with each other.
Okay. Alex, I want to thank you again. As always, every time I listen to you, I learn something new. Thank you so much for participating. I want everyone to understand that all of this content will be available post-conference on Global Health Impact Network. If you're a member, obviously it's free to access it. But more importantly, what we're trying to create here is an environment where not only can we collaborate during a conference, but we can collaborate before the conference with the attendees and interested parties and the lecturers, and then after the conference. That's the whole premise of our collaborative platform. So again, thank you for participating.